Welcome to the Prime Health Podcast with your host, Dr. Derek Barron with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today's episode is going to be amazing. I can't wait to tell you a little bit about how we had the pre-call conversation here, but it's with Dr. Robyn Tiger, and she is known as the self-care doctor. Before we jump in, just a quick note from our sponsor, Grow Solutions. We help health and wellness professionals discover how to double their impact and income without doubling their workload. We eliminate some of the biggest headaches in the business and the practice, whether it's new lead or lead conversion, patient communications where they break down. Maybe there's some operational chaos that you might have, proven systems and frameworks. We try and help you implement those. And yes, AI is a big part of that we introduce to people in their business. But Grow Solutions isn't an agency or a vendor. We are a growth partner to see you grow. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we'd love to have a conversation. Just drop the word grow in below, or feel free to reach out to me on any social platform. But you're here for one reason, and that's to meet Dr. Tiger. I want to introduce you to Dr. Robyn Tiger. She is a double board certified physician in diagnostic radiology and lifestyle medicine and a trauma-informed mind-body expert. As founder of StressFreeMD, she uniquely combines her trainings in medicine, yoga therapy, meditation, and life coaching to teach physicians and whole person's approach to relieve stress while increasing both lifespan and health span. And that's very, very important. Her innovative coaching courses, presentations, retreats, podcast, and book focus on creating effective behavior changes in the key topics of stress relief, nutrition, exercise, sleep, social connection, and nature, while cultivating physical, mental, and emotional well-being and resilience. Dr. Tiger is also the founder of Feeling Stressed is Optional. She serves as the lead faculty and subject matter expert in stress management for the Foundations of Lifestyle Medicine Board Review Manual and Chief Wellness Officer for Women in Medicine, hosts the StressFreeMD podcast, and is a Western Carolina Medical Society Healthy Healing Partner and co-founder of Revive, Lifestyle Medicine, Wellbeing Coaching, and Retreats. She's deeply passionate about successfully guiding physicians to becoming the best versions of themselves and live their healthiest, happiest, and most fulfilling lives. Dr. Tiger, welcome to the Prime Health Podcast.
Wow, thank you so much. It's such an honor to be here. Thank you.
You're welcome. And as I said, we had a little bit of conversation before we started recording here, and I appreciate the words of wisdom you shared with me. And if you share that in literally 3 minutes, I can only imagine how your clients benefit from your care.
Oh, and I'm happy for us to dive into that too, if you want to talk about that during our episode.
That's a great point. We will do that. All right. So as we start this off, I always want to know what was the reason. So was there a moment in your life or a circumstance that took place that said, you know what, I need to choose a career in medicine?
Yeah, so it's so interesting. This takes me back to third grade.
Wow.
I was 8 years old or 8 years young. Or it may have been 7 turning 8, depending on which month it was.
Okay.
And Mrs. Miller, who was my teacher, and if she's listening, hello, Mrs. Miller, she wheeled out this life-size skeleton. And it was at that moment that I realized that skeletons weren't just Halloween decorations or costumes that we wear, but that they actually were inside our bodies. And that began my fascination with the human body.
Okay. Is that what then forced, or I shouldn't say forced, is that what made you decide radiology was the best step for you?
Oh, well, then there's many chapters in between as to where radiology came from initially, and then lifestyle medicine as a specialty after that. So radiology, why did I choose that? Well, I loved everything. So I had trouble deciding on one particular specialty. And in radiology, I was able to focus on all things, all types of people, all ages, all genders, all body parts. I also realized that I was an extreme empath to a fault.
Mm.
So I was taking home all of my patients with me every night, and I was worried about Mrs. Johnson and Mr. Cohen and Mr. Miller and Mrs. This. And I just, all night long, I was worrying about my patients. And it was just that I had trouble. I had trouble separating myself in a professional way as I would if I was an internist or, another primary care type physician. So I realized, and it's important for us to do some self-reflection. And I said, I want to help people, but I need to not help people in that type of intimate way because it's not good for my own self. And so I needed to then focus on a field that would give me enough patient contact, but not the kind of patient contact where I would be bringing it all home with me. And I also thought about my life. And I remember one night, Derek, when I was on call as a medical student, it was on my surgery rotation, and we were actually down in radiology going over a CT on a trauma patient. And my resident, who was a young mom, surgical resident, was calling home to say goodnight to her children. And she got off the phone and she started crying. And she said, I have not seen my children in over 2 weeks to say
Oh,
goodnight to them. And so it became aware to me, even though I was not married at the time and I didn't have a significant other that I was planning on marrying, but just how I envisioned my life was to choose a field that was going to give me the opportunity to have balance where I could work and not bring it all home with me. And then I'd be able to have more of a schedule that I wasn't going to be working 24/7, nights, weekends, all the time. And there were several fields of medicine that don't really change once you do your residency. It continues on with that schedule. And so those are probably the key points as to why I initially chose radiology.
okay. Well, I think you're extremely, if I think about some of the radiologists I've had conversations with, extremely knowledgeable individuals, because you do have to focus on every single part of the human body because you don't know what's coming back up on that slide deck. It could be a shoulder, it could be a knee, it could be, a stomach. What are you looking for? So, and I like how you, probably what led you into the StressFreeMD and the work that you do there, because you realized at a younger age in practice how important self-care was. So, for your sake, your parents' sake, your patient's sake, and the clients that you continue to see, I'm glad you made that decision.
Thank you.
Yeah, you're welcome. So you basically follow the typical pattern most physicians do. You go, after residency, you pick your path, you went into radiology. Was there a turning point then that said, okay, something happened to me? Did you get burned out? Was there something that caused that next change to switch into the lifestyle component?
Yeah, so when I look back, I realized that over several years' time, I started to develop a lot of symptoms and really try pretty much, I would say, somewhere in residency was when I started to develop migraine headaches, which I'd never had, with vomiting, associated with the headaches. And over time, I had a lot of digestive issues. I couldn't digest anything I ate. My abdomen would distend. I would have pain. My bowel habits were all over the place, constipation, diarrhea. My tinnitus, right? So I'd had this ringing in my ears, which got so loud, particularly at night, it was hard to sleep.
Hmm.
And I had vertigo where I would just have this terrible sensation of the room spinning. I had a weird symptom of gums bleeding, like just spontaneously. It's not even when I was eating. I would just have like bleeding gums, which seemed like, what's that have to do with anything?
Yeah.
My body hurt. Like I felt like the Tin Man, like all the time, like from Wizard of Oz. It's the best description I can give where, he's like, oil, oil, oil. Like I felt like I just needed somebody just to like pick off all this tension and cover me in oil, whatever it is, just get rid of it because I just felt so, so tense, like a bored all the time. And I had a really scary symptom, paresthesias, intermittent paresthesias, where my hands and my feet would just go numb. And of course, my left brain, my doctor brain was like, you have a debilitating neurologic disease because why else would that be happening? It has to be something with my nerves, right? And it would happen, Derek, in really scary times. I'd be driving my car. I couldn't feel the steering wheel. I'd be cutting up vegetables. I would lose sensation of the knife. I would be doing a breast biopsy and I would have the biopsy gun like right at the breast lesion, and I'd lose sensation of the biopsy gun in my hand. And my tech would say, "Hey, Dr. Tiger, you're right there at the lesion," kind of like, "What are you doing? Why are you taking so long?" And I couldn't feel it. And so it was really, really scary. And that on top of being exhausted and reactive and anxious all the time, it was just this whole big, muck of yucky symptoms. And I know yucky isn't a medical term, but that's really what it was. I felt horrible. And I didn't recognize myself after a while. And I didn't like what I was doing. I get up every morning having to drag myself out of bed. I counted the hours till I could go back to sleep. I was just unrecognizable as a human. And so I started seeing lots of our, healthcare professionals in different specialties to try and help me with all my symptoms. And I saw gastroenterologists and neurologists and, periodontists and so on. Of course, starting with the internist who's like delegating all of this, and nothing happened. Nothing got better. I took lots of pills. I like a pile of pills I would take like every day. We call it a pill for an ill. I just kept feeling worse and worse. The pills actually made me feel worse. And I had imaging, of course, as a radiologist. All imaging was negative. My lab tests were all negative. Everything was negative. Nothing was showing up as the cause of what was going on with me. And I started to have some really dark thoughts. And then came some dark thoughts, to be perfectly honest. And I had lost 3 physician friends to suicide. And as you may know, the suicide rate has been going up and up, depression, anxiety, stress, suicide over time with physicians. And I started having these thoughts like, wow, this is so terrible. Like, I don't know if I could take another day like this. And it wasn't that I was planning anything. It was just, I was just that down and that dark and that unhappy. And so it was then that I just really saw this fork in the road. And I said, okay, you can either continue how you're doing and hopefully not, but maybe end up like your friends, your colleagues, or you can try and figure this out. Like, figure out what's going on with you. Western medicine is amazing, but in this situation, it wasn't what I needed. And so, Derek, I was already exercising a lot, running races. I thought I was eating pretty healthy. I'm like, what is it? Like, what can I do? And that's when I kept hearing about things like yoga and meditation initially, and then coaching later. And I thought that was for like those weird people down the hall at the gym. I'm training for my races. They're nuts. They're like wearing weird clothes and twisting their bodies up and turning upside down and saying weird things and listening to weird music and blah, 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 right? Which is what a lot of people think. And I was one of them. But I kept seeing this like Yoga 101 series being advertised. And after a few times, I thought, well, I'm at the bottom. Like, maybe I should just see what this is about.
Right.
And the professor of anthropology at the local university was teaching this course, this 101, Yoga 101. So my left brain, my snobby doctor brain, I'll admit it, we are, can be egotistical in terms of like, oh, Molly Moonbeam people are doing this yoga meditation stuff. I was like, she's got to be credible. And this is her studio. And she's a professor. So I signed up. And I remember that day so clearly. I can't tell you how many biopsies I did, how many cases I read. I got home. I fed my kids. I bathed my kids. I hand them off to my husband. And I got in the car for this 7:30 at night class. And the whole time I'm like eye rolling. And I'm thinking, what am I doing? I'm so tired, and I could be doing the laundry and the dishwasher, prepping for my patients for the next day. This is a waste of time. This is ridiculous. Why did you sign up for this? And I walked in there with my head hanging, and I'm not looking at anybody. And I'm like thinking the whole time, this is stupid. And after the very first session, there was this shift. I was calm. My body didn't hurt. I wasn't tired. And my mind was clear. And I said, what? Yeah. What just happened? What just happened? And so to answer your question, that was the first inkling that I had that there was something else that we can do to help ourselves feel better. And then I started diving into that more deeply.
So it was a yoga class that triggered this, but I mean, the fight for, I'm just glad you didn't give up and, succumb to the fight of the mental aspect of it that got you in there. And it kind of, would you say it showed you that I can do things from the inside out, that can help me?
Absolutely. So my left brain was like, what just happened?
Yeah.
Why did that happen? How did that happen? I need more of that. And so I continued with the 5-week series and then continued on into my studies. But initially, I went and started diving into the literature because I wanted to understand what was happening. And as I continued to take the classes and then I got into meditation, we can talk some more about this, that my symptoms started to get better. And eventually every single one went away. Every single one I described to you, including the paresthesias, including the dark thoughts, all of it. And
Sorry to cut you off, Doc. In what
yeah,
time frame was that those paresthesias and all that stuff
yeah.
were going
So
on?
over the course of the first 5 weeks, I would say I just felt calmer and less tired.
Okay.
And then when I continued taking classes and I even started to get more into meditation, I noticed the other symptoms. I was digesting my food better. My bowel habits were better. My body didn't hurt as much. The tinnitus, the vertigo, like all these things just started to lift over a couple months of period of time. I would say that there was a significant change in what I was experiencing. And I was off all meds.
Wow.
I'd seen a mental health care professional and they're amazing, but that wasn't exactly what I needed in that time. And what I needed, and when it came to understand, which is the diagnosis that everyone missed, was that I was suffering from a whopping case of chronic stress. And it was chronic stress and all of the inflammation in my body and all of the stress hormones that were wreaking havoc on my body, showing up in all these different ways, causing me to feel this way physically, emotionally, psychologically, spiritually. And when I learned how to create homeostasis or balance in my body, and then later in my mind, when we started learning the thought work with coaching, it was just incredible. And I've spent, gosh, I don't know, over a decade, 12, 15 years now, teaching
Mhm.
others what I've learned, and I keep evolving. Everything I learn, I share with others. And during this time period of me becoming certified in yoga teaching initially, and then yoga therapy, which is advanced training, being certified in meditation, being certified in life coaching, and then hearing about the field of lifestyle medicine, which is a board specialty focusing on prevention, reversal, and treatment of symptoms, illnesses, and diseases through behavior change, I continue to evolve and get better and better. And I was able to share even more and educate an even higher level and a more whole person level to other physicians, other healthcare professionals, and others that are even outside the world of healthcare that have been interested in elevating their calm and increasing their health span and lifespan and joy and happiness.
Yeah. Well, I want to get to your Revive part of the company that you do, but you hit on the two words that I want to kind of ask you about next. But thank you again for sharing that. I'm unfortunately happy that you went through that period of time, because had you not had that release, that first night and those 5 weeks that followed, it might be a different situation for you. And I am learning more about the guests that I have on the podcast of the issue that's happening with self-care issues, and how people are the suicide rate is not only increasing, but at an unfortunately an alarming rate, especially post-COVID, kind of starting off more so in COVID and post-COVID. So I'm so happy that you're able to find that for yourself, and I'm glad that you're helping others in the process.
Thank
But
you.
you're welcome. But I do want to ask, do you mind just explaining a little bit of your difference between health span versus lifespan?
Yeah, so it's so interesting, Derek, because we talk a lot about longevity and I want to live longer and living as long as I can. And that's interesting in the sense that living in years doesn't necessarily mean living in a healthy way for years. And research shows through the US and Canada, at the very least, that most people in the last decade of life, in 10 to 12 years, depending on what study you're reading, are sick, really sick, like on oxygen, on medications, not moving, like stuck in a chair, can't get out of bed, just not living their life, right? And so that's where we come to understand the word health span. And health span is how many years or how long you live on this earth healthy.
Okay.
So right now we have a gap, a health span, lifespan gap of at least a decade. And what we want to do is try and move that health span closer to lifespan so we don't have such a big gap. So we are living as healthy as we can, as long as we can. And that's the difference.
Okay. Thank you for sharing that. It's important to know. We hear it, but I like your explanation. There's the gap, and that's that slow pullback into the other to make you enjoy the last moments of your years on the planet, which we all should be. We hear those people laying on their bedside and saying, "I wish I would have done this. I wish, I wish, I wish." And hopefully, the work that you're doing, I'm sure, is making a big change.
And that's where lifestyle medicine comes in. Really, we're working really to increase health span. And if we go to blue zones, and if you know about the blue zones are the areas in the world where people live the longest. They have the highest number of centenarians, the highest number of people that live to be over 100. And if you haven't seen it, there's a great Netflix special called Live to Be 100 that Dan Buettner, Nat Geo researcher and head of blue zones, created. And what he did was he went around the world and he was like, why are these people in these specific cities and these specific countries, why are so many of them living in a healthy way to 100 and more? Like, what makes them different? And so he came up with the Power 9, which were like 9 things that he identified that were similar in these individuals around the world. And the American College of Lifestyle Medicine, in lifestyle medicine, we focus on nutrition, and stress, and sleep, and exercise, and connection, and avoiding risky substances. And when we look at that, there's this incredible intersection, so much so that the American College of Lifestyle Medicine and Blue Zones have partnered, and I'll actually be becoming Blue Zones physician certified sometime this year. And so we came to understand that this is what is creating these components, this health span. This is what is allowing for you to be healthier, longer. And this is where our focus is on these behaviors.
Very interesting. I didn't know that there was the Blue Zone coaching or certification that's very interesting. And you do hear of that. I remember I've taken a trip to Greece and a trip to Croatia and seeing, typically it was the older men sitting in the cities and chatting with one another and enjoying life. And I think it does come down to the enjoyment of life, the health span, and the lifespan. So I appreciate you covering that with us. StressFreeMD is a big part of your life, what you do, and kind of reading through some of that. There's a method of stress release that you talk about called bottom up, top down. Could you go through that if you don't mind?
Yeah, so what I came to understand is, and I get a lot of clients that say, I've worked with life coaches and they're teaching me about my thoughts, but it's not really helping me. Like, there's just, I can't use the tools they're teaching me. I can't get out of my head. And what I came to understand is that it's very hard to work with our thoughts when we have a dysregulated nervous system in our body. And we have 60,000 thoughts per day, most of them not so nice, and many of them on repeat. Right. Yeah. And so we can work with our own anatomy and physiology to balance our autonomic nervous system, which is a big word for the automatic nervous system, the things that automatically happen in your body, your breathing, your heart rate, and so on, to create this balance and balancing out the stress response and the relaxation response, these 2 components that are part of this autonomic nervous system. But when we're stressed, the stress response outweighs the relaxation response 100-fold, 1,000-fold. So when we can bring that back into balance and we can bring our heart rates down and our blood pressure down and we can feel calmer and our body can be working at its best, then we can work with our thoughts. And so I call it bottom up first, meaning that first we work with our body and we create that balance. And then we work with our thoughts. That's the top down. And we can work with those thoughts when our mind is clear after we're calm in our bodies.
So I assume in that work, you deal a lot with subconscious and unconscious work.
Explain. What is your question?
Sorry. When you're dealing, especially from the top down, so as you're dealing with thoughts and as that enters into our body, the feelings that the thoughts give us. So you deal like in my understanding, we have a brain that's a circle. The top half of it is the conscious mind. So things we hear, feel, think, all of that gets put into there. And then below that is the unconscious level, the stuff that we don't control, the sympathetic nervous system, parasympathetic nervous system, as you're talking about. So when you're dealing with that bottom up, top down, you're dealing with some subconscious components that we've got to improve upon because our conscious layer is usually blocking us.
Yeah, the conscious layer is, so there really is this bidirectionality happening all the time. So our brain is talking to our body and our body's talking to our brain. And yeah, we have a lot of unconscious and subconscious thinking going on, but we can bring attention to what those thoughts are lots of times by what our body's telling us. So sometimes it's a feeling in our body that shows up first. Maybe it's tightness in our throat or heaviness in our chest or shaking or some palpitation. Sometimes you're more aware of what's happening in your body, and then you get to talk to yourself and say, what am I thinking right now that's creating this? What emotion am I having? Let's label it. And then what's the thought that's driving this? Really getting clear on that. Sometimes we know what our brain is thinking. We're right away. Some of the things we were talking about before that we started recording, sometimes we're aware of our thoughts. We know what they are. We're actually talking about them and saying them out loud. But lots of times we are not quite clear, and it might just be a somatic or a first person experience of something that's happening in your body that you are recognizing first. And then we can go and check in with our brain.
Okay, and that brings me. We'll talk a little bit about what we did from the mindset component when we first had the conversation, because it was you made a one word switch for me to think about. So I was stating that I've got to do this. I've got to get my podcast done. I've got to deal with some personal things that are going. I've got to deal with my business. All these things I have got to do. And you said, Derek.
I said, Derek, you get to do these things. You get to do these things. And even just hearing you say it again, I feel like I was sinking in my seat. It just feels so heavy. All these have to's, got to, ooh. It just feels so heavy, right? And when you change how you speak about yourself, to yourself and to others, when you really listen, it really makes a difference. Words matter. And recognizing that everything is a choice. Everything you do is actually a choice. You don't have to do anything. You don't got to do anything, right? You get to do everything you're choosing. Everything. Whether you're sitting here talking to me, whatever food you're eating, if you decide to take a walk outside, if you decide to do nothing, whatever it is, everything all day long is a choice. And when you start to recognize that, you put yourself in the driver's seat of your life. It's very empowering. You're like, I'm in charge. I get to choose every single thing, right? I don't have to. I don't got to. I get to do or not do everything.
As I said, it was very powerful for me. Just the got to get. I love it. So I made sure I wrote it down when we first started, because it's important that we do that. Yeah. Can you tell me about your business, your practice, if you wish, StressFreeMD? How, if I say, okay, I need to learn more from Dr. Tiger, how does one enter into your practice, and how does that practice flow go that's different from going to your primary care physician?
Yeah. So it's really how people like to learn best. And that's why I keep evolving and growing and creating content in different ways, because people like to learn in different ways. So it's really understanding, first of all, that stress is the umbrella under which all of these other behaviors fall. So stress determines what we're eating, right? If you're feeling stressed out and you go into your refrigerator, you're not pulling out a piece of celery, right? Mm-hmm. Said no one ever, right? Yeah. No, you're craving sugar and saturated fats and all these, you want ice cream, candy, French fry, so, and that stuff actually makes you feel more stressed. When you're feeling stressed, you are not sleeping well. And when you're not sleeping well, it makes you feel more stressed. When you're feeling stressed, you're not a nice person to be around, and you're either barking at people or you're isolating. And when you're doing that, that makes you more stressed. When you're feeling stressed, you are not exercising properly. You're either not exercising enough or in the right way, or you may be over-exercising, which used to be something that I did. So sometimes people go one way or the other. When you're stressed, you may be reaching for other things to buffer, to not feel the thing you don't want to feel. That could be over drinking, doing drugs, over anything. I've got clients that over crochet, over garden, over read trashy novels. I mean, you can over anything. right? To just not feel the thing you don't want to feel. And so it's really understanding, first of all, that stress is the umbrella under which all these behavior choices are made. There's this bidirectionality that's happening. And then learning how someone learns best. So during the pandemic, I had people asking for video content. So I created online video content, self-paced content that was available 24/7. People want one-on-one coaching, just like we're talking right now. Sometimes they're like, I want you all to myself, right?
Mhm.
And so I do coaching. I was coaching all morning before we came on today. And so sometimes it's group coaching. Organizations bring me in. I work with our medical society and several other organizations that say, hey, we want you to coach our group, right? So sometimes it's a group situation. I wrote a book, right? So I had a lot of people saying, do you have a book? And I said, well, I do now. So here's my book. Feeling stressed is optional, right? And so stress is not optional, but feeling stress is
Ooh,
optional.
that's powerful. So if you don't mind, repeat that so I can hear it myself.
Yeah. So stress is not optional. There are going to be things that happen outside of your world as well as within your world, conscious or unconscious. But feeling stressed is optional, meaning you can learn tools to mitigate that stress, right? And again, whether it's specific tools like active tools, whether it's breathing or movement or specific things that I've got thousands of tools, or something that is that's more passive, like determining what you're eating, or if you are connecting with people, or if you're sleeping, and so on. So all of that is in the book. Each one of those topics has its own chapter, and there are QR codes to little videos where I teach you like 5-minute tools, because I frequently get, well, how do I do that? It's like, okay, I'm going to put the how in there. So there's a book, there's a podcast, a StressFreeMD podcast, where I teach stress relief tools, and I also bring experts on to talk about their versions of their stress in their life and how they can help. And I have retreats and I do workshops. So sometimes people bring me in to their retreats or their workshops. Other times I have my own retreats, my own workshops. So really trying to meet people where they are and find all the different ways that people like to learn so that I can help people in the best way possible.
Yeah. Very transformational what you're trying to do for people, which is, they have to be willing, they have to be open to making those changes, but you're offering so many different avenues for them to do that. I do want to ask specifically about your retreats. Is that the Revive the Lifestyle Medicine Wellbeing Coaching and Retreats?
Yeah, so I do lifestyle medicine retreats with my colleague Melissa Sunderman, and we have been taking people to Africa, which is amazing. So we're really excited about our Africa retreats. The transformations have been incredible. You can check out lots of really cool pictures of animals in the wild and hear video testimonials and written testimonials from our past attendees. Some are healthcare professionals, some are not. Some brought their family, their friends. It's really great. I also do retreats with another doctor named Dr. Jonathan Fisher. He and I lead retreats here in North Carolina at Art of Living Retreat Center. And like I said, I get invited in to present at retreats. So anyone out there is interested in either attending or inviting me, I'm happy to chat.
Okay. Well, thank you for sharing that. It's well worth it. I did a little bit of looking on there, some of the African retreats, and that looks amazing. Whether you're a physician or, an individual just looking for a different change in their lifestyle, I think that that's a great thing to do. In your business itself, or I guess in your vast array of businesses, what's your current focus on in your business and where it's going?
My current focus, every year I think about a word that I want to focus on, just like one word. And it's really been impact.
Mm.
This year has just been the word impact. Like, how can I be more impactful? How can I help people in a different way? What are all the ways that I can help others elevate their health and well-being, their joy and their happiness in their life? And so that's really where my focus has been, which is why I keep evolving the types of content that I put out. Because if someone gives me another idea, like someone recently said about an audiobook, so my next thing will be to create an audiobook from my book, because there are auditory learners that don't have time to read or don't like to read. And so it's another avenue. So for me, that's been my focus, is how can I be more impactful? How can I reach the people that I'm not reaching yet? What other ways do people learn where I can create education to meet their needs?
It's a great share on that behalf as well. I can't wait. As I said when we first started, your audio is fantastic on this. I can't wait to hear your book as you read it, because your voice is very soothing as you go through this. I want you to be able to share a success story. So in StressFreeMD, can you share a patient success story that they've gone through with working with you?
Sure. Goodness, who do I choose? So many. I have little gifts and notes from so many of them sitting around my desk right now as we're talking that brings me joy every day. But let's see. So yeah, okay, let's start with this one. So there's a 40-something-year-old female physician married to a physician with a few preteen and teenage children. And she reached out to me because she was extremely stressed, that she was exhausted all the time. She was barking at everyone at work. Her job was on the line. They're like, if you don't get it together, you're out of here. Her kids were like, I hate you. I hate you. Like every time she came home, they didn't want to spend any time with her. Even her dog was like growling at her. She and her husband's marriage was on the rocks. And medically, she found out that she was pre-diabetic and hypertensive, and she was gaining weight and really unhappy with the way she was looking physically. Her clothes weren't fitting. So all around, she just felt terrible about herself. And so this situation is, again, as I talked earlier, the umbrella is stress. The stress she was under at work and being a mom and a wife and taking care of the dog and the house. And she was also involved a lot in her community, and she was supporting family in another country was another thing she was doing. So there was so much, and this stress was that umbrella under which everything else was falling, right? So she wasn't sleeping, she was eating poorly, she wasn't exercising at all, she wasn't connecting with her family, her friends, the people at work, all of these important pillars of lifestyle medicine and blue zones. And she wasn't drinking or doing drugs, but she was just not really escaping in that way. But maybe food was more of her escape, right? So a lot of the foods that she was eating were really unhealthy, and a whole pint of ice cream at a time, maybe a couple times a day, lots of gummy bears. I mean, things like that, right? Because our body craves energy when we're stressed. It doesn't know the difference between a real emergency and emergency that your brain's just creating by its thoughts. And so you want immediate energy, which comes in the forms of sugars and fats, saturated fats, and so on, which is why you want candy and ice cream and cookies and French fries and all that kind of stuff, right? And then those things make you feel worse. So this was her painting the picture. And as we worked together and we worked through a lot, starting first with her stress and teaching her stress relief tools, finding what tools feel best for her, because it's not one size fits all. That's why I have so many. Everybody's different. Again, some people are tactile learners, some people are auditory learners, some people are visual, and finding the tools that were helping her, and then working with her with those other pillars, working with her with moving her body, working with her and enhancing her sleep, her increased connection to self and others, working with her in every aspect there, right? And what ended up happening is her kids thought she was a cool mom again. She and her husband, still very much in love, still together, much happier. She was able to get all of her charting done at work because she was spending so much time stressed and everything, that she was bringing all that home. So she would leave that at work, and when she was home, she was home. She was at work, she was at work. Her blood sugars came down, her blood pressure came down. She was no longer pre-diabetic. She was no longer hypertensive. And we talked about nutrition. I was helping her with healthy recipes and the difference between, eating ice cream because you just feel like you want it today and eating it because you're craving it because you're stressed, right? So it doesn't mean you can't have things. It just means, why are you eating that thing and how much are you eating it, right? And so she started to fit in her clothes again. She was super happy, and she checks in with me every so often, and it's just such a joy to hear from her. So that's just an example of a success story of someone I'm thinking of that just brings me joy to think about.
Well, that's the critical factor that most miss out on, I think, from the lifestyle medicine and how you took care of this patient, is it absolutely had an impact on her. But what it did for her husband and her relationship, and truly, in my opinion, more importantly, is then the mentor / model she was to her children. I'm sure that not only did it, as you said, it improved their relationship, but it actually, their mommy is now modeling a better, healthy lifestyle to live, which the kids need. And unfortunately, I'm sure they didn't have a healthy lifestyle at that point.
Yeah, no, not at all. They were eating a lot of Lunchables and,
Mm.
takeout and fast food and, which only made their them feel worse because we know from research that actually these processed foods with all these chemicals, added sugars, saturated fats actually increase anxiety, stress, and depression. So when you're reaching for those things that you think are going to soothe the thing that you're experiencing, it actually making you feel worse. So
Yeah.
those are the things you don't want to be eating when you're feeling that way.
Well, we've covered a lot of topics, and hopefully you will be able to find time in your day at some point in time that we could have another one and maybe go deeper into something such as mindset or the life coaching that you do to help your clients, because I think it's important on that. If you could share with me, what do you feel that you do better than anybody else in this community to help your clients?
Hmm. I meet them where they are.
Okay.
I show up with no expectations, no judgment, just full of love and caring.
Love it.
And I meet people exactly where they are.
Okay. Thank
Hmm.
you for sharing that. So there's people that want to learn more about that and get involved with you and what they're doing. I'll share all of your links in our description where they can learn all about you, from your books, your audiobooks coming out soon, which I can't wait for, your podcast. But if somebody is interested in learning more about you or potentially becoming a client of yours, where would you suggest they go to learn more?
I would send them direct to my website. That's really where all the information is, and that's stressfreemd.net.
Okay.
Stressfreemd.net. And it's there where you'll find all the things that we talked about, and you can reach out to me and ask me any questions.
Okay. And again, I'll make sure that we put that in the description below. Two last questions before we head out for the day. This is an overall health. If there's one piece of advice you could give everyone that would impact their health in a positive way, what would that advice be?
I would say that you have the innate ability to feel better whenever you want to, which means you were born with the ability to feel better whenever you want to. You just need to learn how.
Hmm. And I assume you can teach them how to do that.
I love teaching
Yeah.
that.
All right. Actually, there's never been a repeat, but that's very, very interesting. I love that one that you shared. So thank you again for that, Dr. Tiger. So the last question, you're a guest on the Prime Health podcast. I'm very appreciative of that. What's your definition of Prime Health?
Believe that prime health is how an individual feels, that first person experience. Are you waking up each day excited, full of life and vitality, ready for whatever that day is to bring?
Mm-hmm.
Do you feel really good at all layers of your being, physically, emotionally, psychologically, spiritually, down to your soul? Checking in with all of that, all of those things. Plato said that the whole is more important than any individual layer of you, right? That the whole is what needs to be healthy. And so my definition of prime health really is, how are you feeling? And are you feeling whole? Are you feeling balanced at all layers of your being?
Yeah. Again, beautifully said. Thank you for sharing that. It's I myself will go back and listen to this quite a few times so I can take the tidbits and learn from it. Because you've been very open and sharing. And again, I appreciate the start of this, how you helped me through a little bit of a mindset component. So Dr. Tiger, again, I really appreciate you being here. You've got such a unique perspective, especially since the skeleton started it all for you going into medicine. And then unfortunately having some valleys in your own career that caused you to make the change. And that, I guess, as you said too, being open and meeting them at the place they're at, because you say going in with no expectations. I'm kind of jumping back here a bit, but going with no expectations is great because somebody needs to share their story where they're at. I think that's so helpful for you to do that. And I'm sure that's why you get amazing results with your clients. So I do want to say, people, like for the nuggets that she gave away, we of course love this information shared because we want more people to hear it. But if you have a physician yourself or a friend that you know that could benefit from it, or if you know a patient that would, just share this for that one thing. Say speed up to 27 minutes and 13 seconds. You've got to listen to what Dr. Tiger had to say. That would make a world of difference because it starts with one, kind of like a butterfly effect. There's many people that can benefit from what she has to share. Selfishly, I'd love for you to subscribe to the podcast and share it to other people. But as I wrap up again, until next time, remember, our wellness journey is about true wellness, and we're all on this together. Now, whether you're taking charge of your own health or guiding others in theirs, every single step matters, no matter big or how small that may be. So I just ask you, stay committed to your Prime Health journey. And again, Dr. Tiger, thank you very much for being a guest on the Prime Health Podcast.
We're all in this together. Thank you so much. It's been an honor.